hello to everybody who's on the webinar. I'm very pleased to be able to contribute, and Camille is just bringing up the first slide to introduce myself and to complement what Subhash was saying. The special program on research and training in tropical diseases, most of the time when we're not in a COVID situation, we're dealing with diseases that are largely endemic, in fact, a lot of the tropical diseases. And then, of course, in WHO, there's a large program, the emergency program. Now, what we've just found by asking some of the people who we've trained in the past is, probably not surprisingly, a lot of the people who've been trained through TDR, even though their training has been largely on the endemic diseases, they have acquired skills and expertise that they're now using as part of the COVID response. So just to explain that the main activities of TDR normally, do we remember what normal is like? I don't know. The main activities of TDR normally are on research and capacity development regarding endemic diseases. But these skills are often transferable, they're often generic, and they are being transferred, we know that, as people who we've trained in the COVID response. Next, please, Camila. So, WHO, if you don't know the WHO COVID website, it is very good. That's a small infomercial from me as a WHO employee. Of course, there are a number of websites that are providing very good information. The Johns Hopkins website is very good, but of course also the WHO website is very good. And this contains the information that is transmitted to WHO from all of the 200 member states of the UN. So the numbers of people as of yesterday, the 27th of people, were coming up globally to 3 million confirmed cases and nearly 200,000 deaths. So this is, as everyone knows, it's a big deal. This is probably the biggest pandemic since the influenza pandemic that occurred just after the end of the First World War. And estimates vary very much, but perhaps about 20 and 30 million people died of the influenza epidemic in 1918, 1919. Commonly said, more people died of the influenza epidemic after the First World War than died of fighting and consequent causes actually during the war. And currently there are 4 countries that account for more than half of all the newly confirmed cases. These are the United States, the Russian Federation, Turkey, and the United Kingdom. I think Subhash and Camille will probably share the presentation later. So to look for the latest data, there are some websites there that you can have access to. And just to say that WHO is an intergovernmental organization as part of the UN. Our remit is to work with governments, and we receive the reported cases and reported deaths. The cases that we're counting are largely the confirmed cases, that is, somebody with laboratory confirmation of COVID-19 infection, irrespective of clinical signs and symptoms. So going back to Subhash's picture of the pyramid, irrespective of whether they're the top part of the pyramid above the water or the lower part of the pyramid below the water without symptoms. So confirmed cases with laboratory confirmation. So the cases are still increasing globally very much. And what I want to do, next slide please, Camila, is to just look at this creature first. This is a pangolin, the poor pangolin. Say again? This is the pangolin. Now, the COVID virus is, like very many human pathogens, an organism that has crossed the species barrier. It's a zoonosis. It's crossed the species barrier from one animal into the human population. This is common for very, very many human pathogens. And probably the story is that there are related coronaviruses in bats, and they've crossed the species barrier into this creature, the pangolin. And then there's been a transfer of the virus from the pangolin into the human population. And of course, there are a lot of complex interrelated factors why a certain virus, in this case, might cross a species barrier into the human population. But all of these factors came together, probably in the famous wet market in the city in China and in Wuhan, and the rest is history, so to speak, as the virus has been transmitted worldwide. Next slide, please. Now, Camila, on my screen, the bottom of the slide, the slide is a bit bigger than the whole screen. Is that, can everyone see the, that's better, thanks. That's it, okay. So what I want to do, having looked at the situation today, I want to take several steps back in time. From the WHO website, I've made copies of some graphs to illustrate the evolution of the pandemic. And it's incredible looking back. It's only the 31st of December when China first alerted the WHO as to the grouping of cases of what looked like a new pneumonia in Wuhan. And this was the very start, the first alert that this was what has subsequently grown into be the COVID pandemic. So going back to the end of January, this is a graph. In those days, at the end of January, there were a total of 82 cases reported outside of China. And at that point, there were nearly 8,000 confirmed cases in China. And the bar chart shows these 82 cases. So when I was looking at these slides and preparing them, I thought this was really, really striking that in such a short period of time, this is just the end of January, we've moved from a bar chart where the vertical axis, the number's a bit small, say 2 cases, 4 cases, 6 cases. This is how we were representing the number of cases outside of China by the 30th of January. Incredible. The next slide, please. Now, by the end of February, we'd moved to this situation for the cases reported outside of China. So these, the numbers on the vertical axis have now changed so that we're going up 300, 600, 900 cases, but still a very modest number of cases compared to today. So the color code is for the different WHO regions. And at this point, at the end of February, the sort of orangey color is the Western Pacific region, and that is largely representing the large number of cases, the relatively large number of cases in China and also in Korea at that point. And then the sort of pinkish mauvish color is the European region, looking at the right-hand side of the bar chart, where we're seeing the beginnings of the epidemic in Europe. And then the other main element here is the purple color, which is Eastern Mediterranean, that is mostly the epidemic that they had in Iran. So at this point, at the end of February, this is only 2 months ago, incredible. We're looking at the curve going up of the cases in Western Pacific region, mostly China actually, also Korea. We're looking at the beginnings of the epidemic in Europe, and we're looking at what seems to be quite a significant epidemic in Iran. So next slide, Camila. So we have the similar epidemic curve. If you look at the vertical axis, we're now going to much greater numbers. This is the end of March, so just a month ago. So the numbers on the vertical axis, they're going up to 60,000. So you can see the tremendous increase in the numbers that are being reported as each successive month goes by. Now, if you look in the middle of the graph, you've got the cases that are basically in the Western Pacific region, that there's a spike, that is an artifact due to a change in reporting. And those are mostly the cases in China. So if we just look at the middle of that bar chart, the crucial thing that we've seen there is essentially the epidemic started in China. It took off in China. The Chinese authorities instituted some pretty rigorous, pretty intensive, pretty strong measures. And actually, they turned the epidemic off in China. So in terms of what Subhash is asking me to present about, the epidemiology and the trajectory, well, there, the story of China is at first a few cases, a rapid increase, the institution of measures to control the epidemic, and actually they turned off the epidemic. So even a few weeks ago, I think they had no indigenous cases arising in China, and the cases they were reporting were all imported. So that is a very, very important case history, let's say. It's not unique to China. Other countries have done it. So Korea saw the beginnings of quite a big epidemic, and again, through very rigorous all-of-society measures that were very rapidly and intensively applied, they also turned off the epidemic. This was seen in Hong Kong and in Taiwan. Now, just to mention Singapore, Singapore, until a couple of weeks ago, would probably also be an example of a country that saw the beginnings of the epidemic, instituted very strong society-wide measures, and turned the epidemic off. However, Singapore is now an example of one of the few countries that is seeing the second wave. Because although Singapore turned off the first wave, actually, it's probably fair to say, didn't manage to concentrate on the immigrant workers who actually have now been at the center of the second wave of the epidemic in Singapore. So if we look around the world, nations shouldn't really be wanting to not heed the lessons learned from other nations. Every country now has its experience. And what are the experiences that countries can learn from other countries? So actually, the second wave experience in Singapore is a pointer that other countries can learn from. Now, looking at the right-hand side of the bar chart there, you can see that this sort of pinkish, mauvish color, this is mostly Europe. And for a large part of the time until the 31st of March 2020, there was that exponential epidemic occurring in Europe, starting in Italy and then spreading throughout all of Europe. And then, in fact, just at the end of the bar chart, we can see that probably the epidemic in Europe peaked there and has started to come down. But the main part of the global pandemic was the epidemic in Europe. Now, on the same slide, taking us through to the end of March this year, you can see that the very pale bars at the top have started to come in. So they probably started to come in something like early March, and those pale bars at the top have increased. This is the region of the Americas, and this is mostly the United States of America. So all regions and all countries are seeing the same sort of phenomenon. This is an epidemic. It's a new pathogen entering the human population. It starts off with a few cases and transmits, and there's usually an exponential growth phase, and then the trajectory depends on what is the extent of measures that are introduced to check that epidemic. And so we've seen a complete check of the epidemic in China. We've seen a partial checking of the epidemic so far in Europe, and we're beginning to see a partial checking of the epidemic in North America. And learning lessons, how do we most effectively check the epidemic? And then the next important step when countries reach the peak and start to check the epidemic is how to prevent the second wave. So the cumulative total of global cases by the end of March was 750,000, with 36,000 deaths. And now next slide, Camila, please. So this is the total pandemic curve from the start. So that I think the times are just not on the bottom of the x-axis there. But this is the total pandemic. So going from the beginning of January to the 27th of April. And so just walking through a couple of the key points that we've seen. So looking early on, you've got that peak, the Western Pacific peak that was mostly China with Korea, Taiwan, Hong Kong, and Singapore. That epidemic is more or less over and done with. Then we see the beginning of the epidemic in Europe, the sort of pinkish color, exponential increase. And looking at that set of columns for Europe, the plateau came on, and then we're beginning to see the plateau start to decrease. We've got the bar of Eastern Mediterranean, that again is still largely Iran. The bars are a bit small, but that seems to have been a fairly constant level of reporting. And then again at the top, you've got, it's mostly the United States of America and the Americas region, of course other countries as well, where the epidemic hasn't yet turned over. Now, an important point that I should have made at the very start is we're talking here about reported cases. And of course, there is a variable relationship between the number of cases reported by a country or a territory and the number of cases that are really happening. And different factors affect that relationship. So of course, what is very important is the testing policy. How many people are being tested in a country? How many cases are confirmed? How many cases are happening but have not been confirmed? So these trends are very important to interpret as the reported cases that can give some indication of the background level of truly occurring cases, but that's an interpretation. Now, if you look at the bottom of the bar chart, the Africa region is the Southeast Asia region, I should say. The Southeast Asia region is the blue color near the bottom of the bar chart. So those are small bars that for the past month or so have slightly increased. So this is the question: what is going to be the extent of the epidemic in the WHO Southeast Asia region? The cases are there. It doesn't look like they've expanded quite as quickly as the expansion of cases that took place in Europe and North America. And similarly, if you go to the very top of the bar chart, I'm sorry I don't have a pointer to point you, but I hope you can follow where I'm looking at. Go to the very top of the bars. There are very small bars that are very light blue color, and that's the WHO Africa region. So cases have been reported there for the past month and a half. They remain reported at quite a low level without showing a very, very dramatic expansion. Now the question is, are we seeing few cases reported because there are few cases, or are we seeing few cases reported because there are lots of cases but they're not being diagnosed and reported? And to be quite honest, I think in WHO region of Africa, it's a bit hard to say. So in the discussion, I'd be particularly interested to hear from our participants from the countries in the WHO African region, what is their experience? What is their intelligence about what is happening? What is the extent of the epidemic in Africa? The number of reported cases in that region is still relatively small. Is it because the true number of cases is small, or is it because we're underreporting on the true number of cases? Next slide, please. Now, we've heard from earlier presenters that the response involves all of society because the impact of COVID is felt across all of society. We've never in our lifetimes experienced such a phenomenon whereby the news every day for 4 months has been dominated only by one issue, by COVID. It's affected every country, it's affected all of us, it's affected everything that we do. This is new, I think, for pretty much all of us. And in the subsequent webinars, I understand from Subhas that you're going to cover, well, what are the measures that constitute the society-wide response, the population-wide measures to decrease risk of COVID-19 transmission, the measures to break the chains of transmission. And I thought, because I've got some slides from WHO, I might tell you something briefly about the importance of breaking chains of transmission, and something briefly about drugs and vaccines. Although I know that these are really going to be covered a bit more substantially a bit later in the webinar series. So next slide, Camila, please. So in terms of diagnostics and testing, we know there are two types of tests: the test of infection, detecting the virus or the nucleic acid of the virus, and test of immune response. So the first one, who has the infection; the second test, who has had the infection. And testing is really important in the public health response. And I haven't watched all of the daily press briefings that the Director General of WHO, Dr. Tedros, gives pretty much every day at the Palais des Nations in Geneva. But I watched one, it must be 6 weeks ago, I think, if not longer. And it was memorable. He said at the end, I want to summarize what I've said in 3 words: test, test, test. And it's very interesting that around the world, very few countries have taken that advice, probably to the detriment of the control of the epidemic, the pandemic. Next slide, Camila, please. So again, I think you'll see this slide probably a number of times, but just to talk about some of the important points here. So it's a slide showing on the vertical axis infection, and on the horizontal axis time. And the blue shaded area in the middle is a period of symptoms. The light blue curve is the curve of the level of detectability of the virus. And then the 2 curves to the right, the black line, which is describing a hump, are the early antibodies, IgM, and the purplish color the line that forms a plateau are the late antibodies, the IgG. Now, an important thing, when you look at the phase of infections, the phase when the virus is detected occurs earlier than the phase of onset of symptoms. And I think Subash referred to this. This is a very important point. We know that some people have the virus and may well be infectious before becoming symptomatic. We still have a lot to find out about the virus and COVID infections, and this is one of the key features. What is the true proportion of people who have the virus before they become symptomatic? What is the duration of that period? And how infectious are they during that period? And how much of those people contribute to overall infection? That's a very, very important issue. Another very important issue illustrated on that slide is about the antibody response. So in many infections, you mount an antibody response, first the IgM and then the IgG. That IgG response, how protective is it? How strongly protective is it going to be? How long is that protection going to last for? At the minute, we don't know. So I'm sure you'll see this slide many times, but there are some very important features there, very important features relevant to how we try to control the epidemic. Next slide, Camila, please. So I mentioned Dr. Tedros, the closing words of one of his press briefings: test, test, test. And very important, identify those who are infected so that those people can be isolated and try to prevent onward transmission, and also identifying contacts, following up contacts, isolating contacts, trying to cut the chains of transmission. Many countries, I have to say, they gave up on finding and breaking the chains of transmission using testing very early on. The reasons for this, to me, aren't very clear, because this was strongly recommended by WHO. This was really crucial in order to try to achieve what a number of countries achieved earlier on, for example, China, Korea, Taiwan. When countries are not finding and breaking the chains of transmission, then they're moving into the phase of mitigation of the epidemic and population-wide measures, but not being able to do the basic public health essentials of an epidemic of infectious disease, basically finding cases, isolating them, contact tracing, quarantining them, and trying to break the chains of transmission. So strong advice from the start of the epidemic from WHO, advice some countries have taken up with good effect, advice that many countries haven't taken up, actually. Next slide, please. Very briefly onto the drugs and vaccines. I know you're going to cover these in later webinars, but this is some information that I picked up from WHO that I thought would be useful to share. So if you're interested, please go to the WHO website and get the details. But people are saying, okay, we're in lockdown. We hope the lockdown will finish. And then when we put our heads above the parapet after lockdown, what's going to happen then? And the research community is working very hard to try to find out which, if any, drugs may be effective in preventing infection, in treating infection, in limiting infectivity. And so WHO is coordinating the Solidarity clinical trial for COVID treatments, and the 4 drugs that were chosen on the basis of laboratory, animal, and clinical studies are those 4 drugs there. You can read them on the slide. So the Solidarity clinical trial is underway to try to find out which, if any of those drugs, may prove to be useful in dealing with the COVID epidemic, both for individuals and from the public health point of view of trying to blunt the epidemic. Next slide, please. And similarly, we're all hoping that the research community will be able to develop an effective vaccine very quickly. Again, this is very uncertain. We don't know for sure if it will be possible to develop a vaccine against COVID-19. We don't know how long it'll take, but the good news at any rate is that 3 candidate vaccines are in clinical evaluation. Those are shown on the slide there in the table, and there are another 67 vaccines in the preclinical development phase. So the field is strong. We know in general that it's a long race and a difficult course for vaccines, and there may be very many starters, and of course it may be only one, if any, that arrives at the end. So we'll just have to wait and see if through this expedited process of speeding up vaccine development, there will be a vaccine, we hope, as soon as possible. The earliest people are talking about is possibly within about, say, 18 months. So this is not going to be the immediate step that is going to save the situation. Next slide, please. So that's summarizing, I think, what I just said about the vaccines. Next slide, please. So when Subhash shares the slides with you, here are some links that will provide you with interesting and useful and valuable information from WHO. So just to say that one of the big pushes in this epidemic, in this pandemic, is for every individual, every citizen around the world, every person around the world to become as equipped as much as possible with the information that we all individually need and collectively need to try to respond to the pandemic. And then, of course, good information is also the enemy of bad information. There's a pandemic of bad information that is being spread by a whole range of people, some of whom shall be nameless, of course, we've heard about the past couple of days. But the responsibility lies on all of us to make sure that we are knowledgeable. Our knowledge is based on what we know, and that we help to contribute to the good info pandemic and help to diminish the risks and the possibility of harm caused by the bad info pandemic. And I think that's it. So that's the end of my presentation. Thank you.